Hello, this is Donna Williams, and I thought I'd make a little clip about my experience with the first chemo. I had a rough time in the first week. A lot of really full-on side effects. Don't really want to scare anybody, but I guess the first thing to say is that everyone responds differently to chemo. So just because this stuff happened to me doesn't mean it will happen to you. And I guess the good side is that we found strategies for most of the stuff. My chemo is 4 3-week cycles where I go in and get chemo, which is IV, for about 3 to 4 hours. And I didn't really have any side effects during that until the end, and then my chest felt really tight and pressing, and I realized that I couldn't breathe properly. And so on the way out I mentioned it, and they put me on the Ventolin nebulizer, and it broke up the muck because I was having asthma, but I didn't realize. And then I went home, and that was 5 o'clock, and around 7 o'clock I noticed that I was really swelling up. So I found my ankles, all my calves, thighs, arms, neck and face were all swelled up. So my neck was really thick and my face was really round, and my arms were really puffed up, and my thighs were really wide, and I was waddling to try and walk, and this was lymphedema. And I've had edema in the past before chemo as a result of allergy to aspirin, so I knew what it was. And I knew at least how to go and look it up and start to take some action. But before we could really take much action, I started to have really wild tremors, palpitations, respiratory distress, really big fluctuations in my heart, and I had hypothermia, so my temperature dropped down to 44.1, I think 40, maybe, I think the first time was 44.8, and I was had chills, and we went to the hospital and they checked my temperature and then had to warm me up with blankets to bring my temperature up to normal, because I was really getting disoriented and dizzy and things were quite blurry. And I went home, and I found it really hard to pee, so that wasn't working for some hours, which is really awful because you have to drink a lot of fluid because the chemo is so toxic. And as you're drinking this, you know, edema is caused by the leakage of proteins out of the blood vessels and into the lymph, and it can only go one way. It can't go back into your blood. So unless it can go up to your heart and then start getting broken down and excreted, then you just blow up like a balloon. So you have to try and turn lymphedema around pretty quick, or it can get really out of control, and then every time you clear it, it just kind of fills up again. And basically all my my lymph was kind of blocked and not moving this stuff around. And my stomach was really coming up. It was so hard and just really bloated. And we got my legs up in the air, got on compression stockings, got me exercising to try and get the lymph stuff going. And eventually by 3 a.m. I was able to pee properly. After 4 days I was able to do the bowel thing properly, because I was so blocked and my bowel wasn't really working. And so you can imagine with chemo and all this lymph stuff, all the toxins just weren't going anywhere. And so this was really affecting my brain. I was disoriented and really fragmented. And I think I was kind of very fuzzy, and I couldn't, later on I lost kind of 7 days. I couldn't really remember with any consistency what had happened in those 7 days. And we had other hypothermia. We had a episode where my temperature was 33.8, and sort of 32 is where you go into a coma. I just found that I was really dizzy and pins and needles, and the room was going all white and fuzzy, and I just found my respiration was really in distress. And so again, we put me to bed and warmed me up, and then I normalised again, and we had 2 other more episodes of the hypothermia. So I think one was 44.1 or something, and again we warmed me up, and this time it came up and then it went back down. And so by now we understood that I was having something called autonomic nervous system effects, which is basically called dysautonomia, and it means that my brain was unable to regulate things like my heart and my respiration and my temperature, circulation, all that stuff. And it goes together with things like chronic fatigue syndrome, fibromyalgia, and can be related to things like brain injury. And basically the chemo just aggravated something that already existed. But finally these effects stopped being so severe. We had some asthma late at night, and my asthma is very odd, so instead of hearing the wheeze and whatever, I just get this really tight compression, and I start to get really dizzy and pins and needles, and then I'm breathing so shallow that we can't hear the wheeze, and basically I'm kind of going to sleep from lack of oxygen. And we decided that was pretty scary, so we found some strategies. So then I started sleeping by taking decongestant, and then we ran a timer to turn eucalyptus oil on in the middle of the night to keep everything from sort of forming really solid guck, and then triggering the asthma. I was having, again, the autonomic nervous system effects to the Ventolin. So when I had Ventolin, I was getting tremors, palpitations, and it was very hard to cross the room. I was kind of falling over, couldn't walk a straight line, and it was very challenging, but we got a really good system going. With the edema, we found that for one thing, I kind of got upside down in the massage chair and shook the edema kind of out of my legs. And Chris, who's my husband, and a friend of ours did lymphedema massage on my legs to help get that out of there. And then I spent 2 hours watching YouTube clips on lymphedema massage and learned all about how if you've got blockages of the lymph drainage at your stomach level, you can't get it out your legs, and that if you've got blockages here at the sort of clavicle point, then you can't drain it out of your neck or your shoulders, and if you can't drain it from there, then it can't drain from your arms. So then every morning I got into a routine of doing the lymphedema massage to free up all these areas so it could drain from my arms, and doing the sort of lymphedema related breathing to free it up around my stomach so it could drain from my legs. I slept with my legs in the air and compression stockings, and then I got the leggings going, which kept it out of my legs and my stomach. And then we cut some sleeves that belonged to, I found these baby stockings and cut them so that I could wear compression sleeves, and that got the lymphedema out of my arms. And once it was clear here, it could start to drain. So by about day 6, the lymphedema was really low. And doing yoga every day seemed to stabilize some of the dysautonomia, the autonomic nervous system disorders. And of course, then the standard stuff when immunity drops around day 7. So I currently have no neutrophils, so I have neutropenia. And I get another blood test on Tuesday to see what they're going to do about that and whether my body has started making them. And with that comes things like lots of mouth ulcers. So I had about 6 over here and had some here and some on the top of my mouth. And I learned that vitamin B can reduce them. So I had a really good liquid vitamin B. And I'd do that, and then I would put the SM33 on them and kept my mouth really kind of washed and flossed and enzymed and all that stuff. And I found I could get rid of the ulcers within about 8 hours. They would just go down. So then new ones would come up, and then I'd do the regime with them. So that really helped me to get on that. So pretty much I felt like a bit of a champion because I had beaten lymphedema and I'd beaten the mouth ulcers, and I got a sinus kind of inflammation that just kept threatening my lungs. So I did the salt flushing. It's a salt water and xylitol in a jug of warmish water, and you get a sauce bottle and hot, you put that in there and it comes out the other side, and you have to flush all your nose. There's YouTube clips on nasal flushing, and basically I'm from a background of primary immune deficiency, so I used to have to do that twice a day. So that kept me from getting infections from here down into my lungs at a time where I have no white cells. And the fact that I'm breathing the eucalyptus oil twice a night, which is on the timer, so it starts up while I'm sleeping. And that allows us to get sleep in the household and also to keep any sort of germs from spreading. And I'm also on doxycycline, which I was on for primary immune deficiency, and they started up again once I was doing chemo. And that stops me from getting most bugs, even though I have no immunity. So it's scary, and I have to wear gloves with everything, like be really careful. And of course my nails were all splitting at the base and turning grey. And I've got like, I think about 3 or 4 levels of nail hardener. So far, pretty much my nails have broken off at the bottom, but they're just still there. So I'm kind of excited. I still have fingernails. Of course, it's week 3, and so most of my hair is really going now. I shaved it off before chemo because I wanted to feel that being bald was just being bald. It's not about being sick, and to just feel the freedom of saying, the bald thing is just the bald thing. It doesn't define me. I'm still here. So that's okay. And I deal with the fatigue. That's all right. I just do the nap thing, and I've had chronic fatigue in the past, so I just say, oh yeah, a little more of that. And with the dysautonomia, the autonomic nervous system stuff, it can cause some kind of, muscle fatigue things throughout, and has throughout my life. So I just say, yeah, more of the same. And pretty much we just make protocols for everything, and we stay on top of it all, and in between really enjoy our time together, and our silliness, and the wonderful closeness that we have about it all. I think one of the hard things was occasionally just having people with narcissistic stuff want to drop by and self-advertise, and it's as if they see cancer as some kind of Oprah show, and it's their big moment, and I just find that really tedious. So I don't think those people have any idea really what it is to to deal with the seriousness of kind of what we're dealing with, and I don't know, I just think that's really silly, you know. Anyway, but life takes all kinds, and there's also some just wonderful people around us who you know, who are really practical and real and sort of coming from the right place, and that's really cool. So that's pretty much it, and I'm off for my second chemo next week, so we're pretty daunted about that. If my white cells don't come up, then I guess I have to get injections, which are things like Neulasta. I think they use a different one here, but essentially it causes your bone marrow to start producing more white cells, so they can dare to do more chemo, which will knock them out again, and they have to give you more injections. Apparently the injections can make a lot of bone pain and rubbish, so I've had fibromyalgia. It feels like grinding pain in your bones, so I assume it's pretty much going to be similar stuff. It has some side effects. Seems all of this stuff has side effects, and I guess I'll just deal with it, you know. The way I see it is that this is all part of me getting a longer expiry date, and it's what you do to get a longer expiry date. So, you know, hopefully all this stuff on the way doesn't kill me, and my theory is that there's certainly, doctors are not in the business of trying to kill you. They're not going to do this unless you've got more chances as a result of chemo of living than you have without chemo. And they already ascertained that my chances without the chemo was a kind of 1 in 4 chance of being dead from secondaries. So I guess compared to that, chemo is a low risk thing, even though they're obviously working with someone who's got a very quirky brain that has some challenges in regulating the body. So let's see how it goes, and I look forward to hopefully being this healthy and being able to drop by after chemo number 2. So that's it. Donna Williams, and I'm going to go. Thanks, folks, for listening. Bye.